Welcome to STEM Careers with Newton's Road for 6 to 12 students. Each week, we will be joined by experts from regional businesses and career-oriented education and training programs to help you explore STEM-related careers in our region. My name is Barbara Todd. I'm the Executive Director of Newton's Road, and we're a regional nonprofit supporting STEM learning and career exploration. I have with me today our Michigan Tech University intern, Annalisa Fiesner.
Hi, everyone.
And our special guests today are Adriana Termaat-Matthews of Illumina Corporation and John Hervoso, a graduate student in biomedical areas at UCLA. And they're here to talk with us about biomedical engineering. So John is born in Bolivia and moved to the US at 18. He received his biomedical engineering degree a year ago from University of Michigan and is now pursuing a doctorate degree in bioinformatics, like I mentioned, at UCLA. And his life-changing events are participating in an international science conference and studying abroad in Australia. And Adriana is currently working as a biomedical engineer. She graduated from Elk Rapids High School and the Manufacturing Technology Academy in 2016 and just got her degree this spring and started in June at Illumina, which is a biomedical company in San Diego. And she's halfway through her master's degree in engineering management, also at U of M. Welcome, John and Adriana.
Thanks for having us.
Thanks for having us. Hi, everybody. We're very happy to be here and excited to share with you guys what biomedical engineering is and all about, and the career paths that you can choose and have within this great field.
All right, let's continue.
Fantastic. So this session will be recorded and available on our Newton's Road Facebook Live and YouTube channels. And if you're joining us live on Facebook right now, please put your questions for John and Adriana into the comments area. And before getting back to them, we're going to share with you a little bit about Newton's Road. This is our website that you're seeing right there, newtonsroad.org. We are a 10-year-old nonprofit, and so excited to be celebrating our anniversary in serving the 5-county region here and helping youth and families to access the STEM learning and career exploration opportunities and to become great problem solvers. If you go down our website page, there's a place where you can sign up for our monthly newsletter. This is a great way to hear about our future programming, and not just from Newton's Road, from all around the region, and celebrating people who have won contests, youth who have won contests, and other things. And our STEM at Home page has all the recordings from these sessions on it as well. And it's a great way to find any of the other careers that we have. And you can see a wide variety there that Annalisa is showing at the moment. We also have a page that's devoted to career exploration. And these resources vary from something that are local, like that Connect Up North and cool companies in Northwest Michigan. But we also have general resources that can help you pursue other careers, such as from Junior Achievement, which is national in nature, and ONET, which is a national database. And there's others that are just for Michigan. So it's a great resource all in one place where that can help you exploring your careers. And at the very bottom is a video of 4 people sharing about their careers, including me. And right now, though, without further ado, we're going to get back to John and Adriana. We're so excited to hear about this relatively new career field that is actively growing. Over to you. You need to unmute.
Yeah, sorry. Thank you, Barb. As I was saying earlier, we're going to be talking about what biomedical engineering is, what type of specialties you can have in biomedical engineering, and the different career paths that you can take within the field. As we're going to see, there's a lot of different options. It's a pretty broad field with a lot of opportunities to have a great career in. So to begin, we're going to talk first what biomedical engineering is, and it's probably one of the most common questions when you meet somebody, you tell them you're a biomedical engineer. So biomedical engineering is, on a basis and a broad level, is integration of engineering, science, and medicine in order to develop devices, implants, and therapeutics to improve health and quality of life. So this is pretty broad, but the biggest thing about all of this is we try to apply engineering concepts that have been proven through years and years of engineering into medicine to create new technologies that will help physicians and doctors to help patients. So as we're going to be seeing in the next few slides, this has a bunch of different flavors. Next slide, please.
So besides biomedical engineering being a fascinating field, there are a lot of other reasons why you should consider being a biomedical engineer. First and foremost, it is a very impactful field, and we are truly working every day to improve the quality of human health. As we mentioned, this is a relatively new field. Most universities' programs were developed somewhere between 20 and 30 years ago. But the career opportunities have exploded, and we'll talk a little bit later about many of those career paths and opportunities. For starters, engineering pays well, and so that's a comforting thought as you invest in your education, is knowing that you will have a stable career after that. And another unique part about biomedical engineering is that this is one of the only disciplines of engineering that is pretty split between men and women. So for example, more traditional fields like mechanical engineering and computer science tend to be more like 70 or 80% men and much fewer women. And biomedical engineering has much more women, almost to this 50-50 split. And in my opinion, as a result of this, biomedical engineering is one of the more social engineering disciplines, not only because of the amount of women, but because of the nature of the work. As Jonathan mentioned, we're kind of at this, this integration of engineering, science, and medicine. And so since we have such this interdisciplinary nature and we're having to communicate with a lot of these different facets, we have to be excellent communicators, which makes us a pretty social discipline. All right, next slide. Go ahead.
So to begin with the specialties of BME, we're just going to do a little bit of overview. We split these in a few main categories. Of course, each of them have subcategories, but to begin, the main categories and specialties of BME are mechanical, electrical, and bioinformatics, which happens to be the most recent one. And we're going to go a little bit more in depth into each one of these in the next few slides to tell you about what the differences are and then how all of these actually integrate with each other, which is one of the biggest things about biomedical engineering. It's a very interdisciplinary field that likes to collaborate between a lot of different disciplines in engineering, medicine, and science in general. And to begin this and to motivate what we're going to be seeing through the next few slides, we're going to show a little bit of a video that integrates actually a lot of the mechanical and electrical components. And it's a very good example that it's not necessarily a medical application to biomedical engineering, but it's the very definition of biomedical engineering, where we take biological concepts like the movement of the body to apply it to mechanical concepts and electrical concepts in robotics to create a very human-like robot that a great team has been working on.
So this example, as Jonathan mentioned, was an excellent example of focusing on the more mechanical aspects of biomedical engineering, specifically building a mechanical robot that models the human body. So more broadly, there are many ways, many applications for the mechanical focus of biomedical engineering. In general, people focusing on the mechanical side of things tend to design, build, and test different biotechnologies, implants, and medical devices. So one example of a medical device is in the bottom left here, a stretcher. And so anything that is seen as a mechanical device in the healthcare or medical field is called a medical device. And so these are examples of things that biomedical engineers help contribute to design, test, and build. The next example here is in joint replacements and implants. This is an example of the need of biomedical engineers to consult on, for example, the biocompatibility of all these joint replacements, as they are in the human body for years and years, and we need to make sure that they are safe to be put in human bodies. In the top right here, we see prosthetics, which is what many people think of when we say biomedical engineering. So things like here is a hand prosthetic, or leg prosthetics. And these focus on the mechanical design. Again, like the robot, they focus on modeling the human body. And more on the biotechnology side, that is not directly interacting with the human patient, but focuses on processing and diagnosing, is a genome sequencer. So I like to highlight this because this is the work that I am doing right now. So I work at Illumina, which builds these genome sequencers. And they sell to consumable companies like 23andMe and Ancestry.com. So through biotechnologies like genome sequencers, you are able to sequence your entire DNA to then determine where your ancestry came from and possible what diseases you are predisposed for. So there are many applications for a mechanical focus of biomedical engineering. Okay, next slide. So with things like the genome sequencers, in addition to needing mechanical support and design, they of course have other components like software and hardware in the electrical field. And so most all of the biotechnologies and medical devices that are on these slides and that we'll be highlighting has all of these specialties. So it will have, a chemical team, an electrical team, and a mechanical team. And generally, as a biomedical engineer, you would pick one of these to specialize in and then contribute to in your career. So here are a few examples of medical devices that focus on the electrical side of things. So on the left-hand side, we see an ECG, which is used to monitor brain waves. And in the middle, we see an MRI. So imaging is an excellent example of a biotechnology that focuses on the electrical side of things. And so almost all imaging techniques use these electrical specialties. And on the right here, we have a pulse oximeter, which assesses the amount of oxygen in your blood. And this is used in diagnosis and monitoring for many patients. And so these, again, are focusing on the electrical and more the software focus of biomedical engineering. Okay, next slide.
And then we have a little bit more of the chemical side, and the chemical side is very related to what you would think and the work you would do if you were a chemical engineer. But I think the main distinction you do when you're a biomedical engineer or biochemical engineer working on the chemical side is that you tend to use cells, organism, and biological molecules as the ways to do the processes and develop the products that you want to develop. And within chemical engineering, we have two main subfields, I would say, one of which is tissue engineering, and the other one is pharmaceutical engineering, which I'll be talking about in the next few slides. But in a broad sense, chemical engineering or biomedical engineering in the chemical sense is the development of processes and optimizing these processes. Because at the end of the day, that's what you want to do as an engineer, be the most efficient you can be with the processes and products that you have. So I'm going to be talking about tissue engineering, pharmaceutical engineering next. So for pharmaceutical engineering, this is very similar to what you would think somebody with a pharmaceutical degree would do, but it's much more related to the actual development and discovery of the products and how to develop processes and manufacturing processes as well on top of the discovery processes that will allow technicians to carry out these roles. So in this field, which is very large and has been seen a big shift for biomedical engineers going into this field, just because of the new techniques that have been developed. You want somebody that knows how the actual science work of the discovery of the drugs, but you also want somebody that knows how to make efficient manufacturing processes, which is where a biomedical engineer comes in and helps bridge the science with the engineering and the manufacturing. Then this leads to operations roles and managerial roles, which is something that we're going to be seeing with some of the roles we're going to be mentioning in career paths. Biomedical engineers tend to be hired a good amount for technical roles, but a good amount for managerial roles because they are so broad and understand so much of the different specialties that they can have a good understanding to manage different teams with different specialties. And on the tissue engineering side, it's quite an exciting field, and it's very what you would think of a research focus and a science focus, but incorporates a lot of engineering concepts that previously a biologist wouldn't incorporate. So this is why biomedical engineers, I think, is the picture you paint in your head and tend to shine, where you apply these engineering concepts, qualitative concepts, quantitative concepts, my bad, and into biology to develop new materials and new methods to improve and replace biological tissue. So examples of these will be, so screen grafts. So for when somebody gets burned, biomedical engineers have designed these artificial skin grafts that are made from cells made in a lab and allow the patient to heal better. So the aim of tissue engineering at the end of the day is to aim to restore the mechanical and structural properties, which is where the engineering comes in, but with the focus of artificial organs and tissues. And then as the last specialty of biomedical engineering, we're going to talk a little bit about bioinformatics, which is probably the newest one. And by newest one, it's probably close to 5 to 10 years old as a biomedical discipline. And this has come from what Adriana was mentioning before, the genomic sequencing. So sequencing of the DNA allows us to gather a lot of information from patients and people, and use this information to do a lot of different things. So as a broad term, bioinformatics is the combination of mathematics, computer science, statistics, and biology. So a lot of what engineering is, but with a little more flavor of computer science. And what you do in this field is apply all of these engineering concepts and apply them to computer science, but with a focus on a lot of the data being biological. So this biological data can be a lot of different things. So the genetics, proteomics, which is the study of proteins, precision medicine, which is one of the biggest ones, and drug discovery. And for just as a quick example, precision medicine is when you gather this data from the patients and you can tell how different one patient is from another, but have the same disease, and how we can treat that patient with a specific drug or a specific treatment catered to the differences between that patient and another patient with the same disease. So this is a pretty new exciting field, and is actually what I've decided to pursue for my graduate studies. But it's one of the more recent fields of biomedical engineering.
So this is more generally a little bit talking about professional organizations in college. So whatever discipline you choose to pursue, and if that leads you to a university, I would highly recommend joining some sort of professional organization. This is actually how Jonathan and I met, and we can both testify that it really transformed both our personal and professional development throughout college. So we joined a professional biomedical engineering fraternity that is actually only at the University of Michigan because it was founded just 5 years ago. And so we focus on philanthropy and social and professional development. But in general, at other universities, there are many other sorts of professional fraternities and organizations. Some of the more national organizations are KTP and Theta Tau. And these are not specific to biomedical engineers, but they are specific to technology and engineering, respectively. And as I mentioned, these are more broader, and they're at many universities. And furthermore, there is BMES, which is Biomedical Engineering Society, and SWE, which is Society of Women Engineers. And these are offered at almost all universities. They have a national presence, and these are more focused on professional development versus the ones that are fraternities are going to have that more of a social aspect. But I must really emphasize that this has transformed our college experience and has helped develop which concentration of biomedical engineering I wanted to pursue, and has helped me secure internships at jobs, and has just through having a community of biomedical engineers, especially in such a new field, has helped me navigate the territory and decide which path is best for me. So I would highly recommend joining this if your university career leads you to.
In addition, just to add a little bit on the previous slide, is all of these organizations help really build a network within your school, and with the more national ones, build networks of people that have already graduated and are already in the workforce. So this allows you to have a bigger network before you graduate of people who have experience in the field that you're interested in, so you can talk to these people and figure out that the jobs that have had this since they graduated and up until this point are something that you'll be interested in, and get connections and first-hand experience on these fields, and be able to talk to people that can relate to you through these organizations. And as Adriana was saying, Biomedical Engineering, BMES and SWE also put great affairs and conferences for undergraduate students while you're in your undergraduate to go and participate and meet people. And this is really, I think, one of the most important things you can and do while you're in college, is build your network as much as you can and meet as many people as you can. Mm-hmm. Because this will lead you to either jobs or friends that will then lead you to jobs, or create a network. A professional network is very, very important, because you never know who's going to need a hand or who you can build a team with. So yeah, it's joining a great professional organization is a very important part of your undergraduate education.
So next, we're going to talk a little bit about the people who make great biomedical engineers. So in the bottom right here is a picture of our professional fraternity, and most of us are studying biomedical engineering. And so this is an example of the diversity of, you can see the ratio of men to women, you can see the diversity of our population. And so really the point is anyone can be a biomedical engineer. Specifically, the ones who will thrive are people who love learning new things, especially related to science, technology, engineering, or math. And I will add helping people in the healthcare or medical sense. That leads me to the second point, which is being passionate about improving human health. So one of the unique benefits of studying biomedical engineering compared to other engineering disciplines or other majors is that we have such a direct impact on improving human health and longevity. So as we've mentioned before, biomedical engineering is a very interdisciplinary field. We kind of have a mix between computer science and traditional engineering disciplines like chemical, mechanical, and electrical. And because of the interdisciplinary nature and working with physicians as well, one of the requirements is that you must thrive working in teams. And so, as we mentioned, building all these medical devices or doing any of these research and studying, you are going to be working with people, with physicians, with scientists, and with other engineers in different disciplines. And so this is an important aspect of particularly being a biomedical engineer. And as all engineers are, we stress that being a creative problem solver is an important aspect and something that will be developed through coursework and experience. Go ahead.
And then just to highlight the potential, now that we've talked about the specialties, now to highlight the potential career paths. So basically, biomedical engineers can go into pretty much every single field that you can think of. So you can go into industry to have, as we were talking about, the technical roles we were talking about, or managerial roles. As I was saying before, it's very prominent that engineers have been going, biomedical engineers specifically have been going into very high-level managerial roles due to the nature of the interdisciplinary work that we do. Another way you can follow your BME career path is through academia, and that's what I want to do, and I'm doing right now. So you can pursue a master's degree and then go back to industry, or pursue a doctor's degree and also go back to industry, or stay in academia and become a professor. And something that has been more common recently has been for biomedical engineers to actually go to medical school. And the reason for this is biomedical engineering, a biomedical engineering degree provides you with a very good backup in case medical school doesn't work out, or it's something that you reconsider down the line. It provides a very good background for the application of med school and makes you a very, very competitive applicant due to the amount of coursework that you're going to be taking. And helps you distinguish from a lot of the other applicants as well. So on top of this, other than med school, we've had quite a few friends that have gone into pharmacy school as well as dental school. So those are options that you can follow as a biomedical engineer as well.
So there are many paths to becoming a biomedical engineer. In high school, as I mentioned, I attended Manufacturing Technology Academy, which is at the Career Tech Center. And I would highly recommend doing any of these programs, particularly MTA, as I feel like it gave me the general engineering preparedness and the ability to be able to work hands-on with robotics and other projects in high school. If you would like to start your college career at NMC, they also have a great prep program in which you can transfer to another university. So this can save some money long-term. However, you must be careful when you are looking at which courses will transfer to your university of choice. And if you do choose to either go through NMC or to go directly to a university, you can get a bachelor's and or a master's in biomedical engineering. Okay. So I urge you to explore your interests, whatever they are. If that's biomedical engineering, that's wonderful, and anything else. So this means joining robotics teams, science fairs, leadership positions, any of these. I encourage you to shadow friends and family and volunteer just to explore what options there are and what your skills and interests align with. And explore career options and expectations. So where you want to live, how much you would like to make in your job, and what sort of industries you are interested in. Are there any questions?
There's one question. You've talked a lot about working in an interdisciplinary team, like at a company. Do biomedical engineers ever work with doctors and patients?
Absolutely. So there are more clinical facing roles for biomedical engineers. So for example, something like a technical sales or what they call a clinical engineer. And so these are biomedical engineers who focus more on interacting with the customer. And in the case of biomedical engineers, the customers are often physicians. And so these are people in the technical sales role who either are selling some of the medical device equipment, or in a clinical engineer space is something that you would go into a hospital setting and then assess what needs to be improved, and then go and work with the design team to then design the improvements.
Thank you. Annalisa, did you have any other questions coming on your end?
Yeah, so you guys had mentioned the four specialties: mechanical, electrical, chemical, and bioinformatics. Do you study all four of those in school? And how do you pick which one you want to specialize in?
So you kind of do study a little bit of all four, at least in the program at University of Michigan, and I think quite a few other schools have a similar model where your introductory courses to biomedical engineering actually give you a little bit of a flavor of everything, right? So, and the whole point of the biomedical engineering degree is that you can actually talk about and know about all of these disciplines. But in your later years in in undergrad, so in your junior and your senior years, you will specialize more in one that you choose. And you mentioned how do you choose one of these disciplines. And I think one of the best things that you can do to explore more of these is actually extracurricular activities while you're in undergrad, so your first few years. So there's a lot of design teams that focus on the mechanical aspects, right? If you can join, maybe even I had a few friends that joined the racing teams in the school. So like the solo car teams or the Baja racing teams, and those because they were more interested in the mechanical aspects. If you're interested in the chemical aspect, you can join a research lab and do a lot of research in the biomedical field, as well as with the electrical. So the electrical, I think, is probably one of the ones that is a little bit more complete in the sense that you can do a lot of research on it, or you can go and join teams, design teams as well, to get some experience on the electrical field. It's a little bit more difficult because you need to have a little more expertise, and it's probably one of the fields that requires more expertise for you to be able to do work. But there's a lot of opportunities, and I think the best way to do it is go and get hands-on experience with each of these disciplines.
Mm-hmm. And to add off of that, you can get that hands-on experience either if you have the opportunity to do an internship or to shadow, or we spoke about the benefits of having a robust professional network. This is one of the benefits of having that, is to be able to speak to people about their experiences and decide which career path is right for you. But as Jonathan mentioned, you have an introduction to all 4 of these disciplines early, and then you will focus on whichever interests you based off, hands-on experience or in industry or shadowing or just conversations. So,
and don't be afraid to try to try things. Sorry, but yeah, I think the last thing is don't be afraid to try things. I think that's one of the biggest things I've learned through all these years is go and try things and experiment. And it's okay if it doesn't work out. It's okay if it fails. You learn something. By failing, you actually tend to learn a lot more than not failing. So go ahead, go try, give it a try. If it doesn't work out, it'll be okay. So yeah.
If you decide to go into a different type of engineering, such as mechanical or electrical or chemical, could you choose to then still work in biomedical engineering with one of those degrees?
Yes, and I think that's one of the things that it's a field that is very broad and it has so many applications that you don't necessarily have to be a biomedical engineer, or you decide to be a biomedical engineer later in your career after you have a degree or even after you have a job. So a lot of the people that started this field, right, started with just purely technical degrees in those specialties, the electrical engineers, mechanical engineers, and chemical engineers. I think the biggest thing is having the disposition and the desire to learn once you join this field. And more often than not, you will have no problem transitioning into biomedical engineering with one of these degrees already.
Mm-hmm. And so to add on to that, one way people often do this is maybe to get an undergraduate degree in one of the more traditional disciplines of engineering, or even computer science, and then to get a master's degree in biomedical engineering. So there you really get the fundamental education of mechanical, electrical, or chemical, and then to apply this, as we talked about what biomedical engineering was, to apply this to the body and to medical applications and biological applications. And so that's quite common to do another engineering of discipline and then a master's, or even if you do your undergraduate degree in biomedical engineering, BME is one of the more common majors to pursue a master's degree in biomedical engineering, just because, as you can see, there's so much jam-packed. It's such an interdisciplinary major that a lot of times people pursue a master's degree to then focus that down on one of the many applications of BME.
Good advice, thanks.
And perhaps each of you can share just briefly how you decided to pursue, because both of you started college as a biomedical engineer, if I recall, and you also ended being a biomedical engineer, which a lot of people change their fields. So could you just speak to how you chose that in the first place? Like did you know it from an early age, or did you, what process did you use?
Why don't you go ahead?
Sure. I'm a little bit of the exception of people and that kind of wanted to be a biomedical engineer before I even got to college. But the reason why I wanted to do it wasn't purely just biomedical engineering. I actually wanted to, what I thought was a career path was a genetic engineer. And I read when I was in high school that you had to go to biomedical engineering undergrad and then have to get a doctorate degree. So I was like, okay, I'm just gonna have to do it. But when I went to biomedical engineering, I realized how much I actually enjoyed the field. So I started with biomedical engineering and saw how interdisciplinary the work was, and how many opportunities I could have to pursue later on. I ended up not being a genetic engineer, but pursued a different degree that I don't think would have been open to me if I didn't do a degree in biomedical engineering. But yeah.
Mm-hmm. And a little differently, in high school, I excelled in math and science. And so one of the natural career paths for that or studies is engineering. And there are many, many different disciplines of engineering. And then it was narrowing down which of those I wanted to study. And so for me, it was because I not only enjoyed the math part of things, but the science part of things, that's what led me to biomedical engineering and the impact that this field has. And so we're still using the fundamental engineering concepts. We are just applying them directly to build biotechnologies and medical devices that directly improve human health. And so for me, the impact and the relationship with the human body, I think was fascinating to me. And another thing that I will say, it is unique that we are here, two people that came in as biomedical engineers and went out the other end and graduated with the degree. And I think one of the aspects that allowed us to continue and stay and engage in our field is that professional network. So having people who were in the field and then seeing what they could do with it, I think it really enables you to stay engaged with the field if you can understand where you might be in it. So for example, I could look at other people who are working in industry and I said, that's what I want to do. Whereas Jonathan was looking at people who had done PhDs and said, that's what I want to do, and ultimately go to teach. And so because we could see these different people through our professional network that had pursued various careers and we could imagine ourselves in them, I think that helped us not only pursue this initially, but to continue to stay engaged with it.
Well, thank you so much, John and Adriana, and thanks to all of you who have joined the STEM at Home Live with Newton's Road. It was fascinating to learn all about this field. And we also want to note that we would not be here if it weren't for the support of our sponsors and partners and other supporters listed here. And if you'd like to share with us another comment on Facebook about what you liked or other fields you'd like to see, we welcome that. And we hope that you will join us again next Thursday when we'll be looking in an IT field called Systems Administration. And as a reminder, all those recordings were on our website from all the different fields, including this one will be there as soon as this episode is over. See you next time.